Thank you. Good morning, Mr. Chair, members of the House Health and Human Services Committee. My name is Chad Bishop, and I'm a resident of Sioux Falls. Today, I sit before you as a proponent of the House Concurrent Resolution 6012, and I wish to express my gratitude to Representative Aylward for bringing this resolution. The document is by no means perfect. It should be 50 pages long. I would offer several amendments. Nonetheless, it serves its purpose to get you and your colleagues to begin reflecting on this subject. I urge you to pass it out of this committee and allow your colleagues to consider, review, and amend it, maybe pass it. Time is short, the document is long, so I'm going to focus on how the average South Dakotan might view the medical ethics surrounding the vaccine mandates. I reserve the right to be wrong. Quote, "It's been proven that when you make it difficult for people in their lives, they lose their ideological BS and they get vaccinated," as quoted in the book Fauci by Michael Spector, Pushkin Industries, publishing 2021. For me and my family, it wasn't so much ideological BS. As a child, I had Guillain-Barré syndrome. They called it French polio then. I woke up one morning and I couldn't walk. My mom, whose sister is a paraplegic from polio, was extremely concerned. My father carried me into the hospital. Once they had diagnosed it, it took about 6 weeks for me to fully recover. If you don't know, no provider in the country will give me a flu shot. The benefit does not outweigh the risk. And if you ever fill out the little form, the third question on it is typically, have you ever had French polio or Guillain-Barré? Now, my uncle also had Guillain-Barré. This is about a 1 in 200,000 persons per year type of event. And he went from a up at 5, work till 10 rancher farmer from Thunderhawk to in the VA at Sturgis for 9 months, 3 of them on a ventilator. If I were to have a relapse now, my outcome would look more similar to his. He never fully recovered. He was able to walk and speak, but all fine motor control was lost. So think back a bit and remember how intense the government and media messaging were around the COVID-19 vaccine campaign. Remember the anxiety and the constant sense of fear they induced. Shame. Remember how they pitted families, friends, coworkers, employees, and employers all against one another, take jobs, kill careers. Quote, "It's been proven that when you make it difficult for people in their lives," from Fauci. Do you remember how enthusiastically some were about curbing the civil liberties of those who chose not to be vaccinated? For myself, I became seropositive before the vaccine was offered to my age group. The cornerstone of their ethical argument was that the vaccines prevented infection and transmission, thereby halting the spread, and everyone would do their part to protect one another. Hope that we might just go back to normal. Therefore, the shortened safety studies and timelines of the President's Operation Warp Speed were justified and rationalized. How long are the normal midterm and long-term safety studies for vaccines? This resolution accurately documents multiple studies calling into question these foundational arguments. Before the announcements of many of the mandates in July of 2021, as documented in the resolution, the journal Cell takes a jackhammer to the question of durability and efficacy of infection-induced immunity. In August of 2021, Fauci himself, as documented in the resolution, arguing that viral load in the nasopharynx of vaccinated individuals with breakthrough infections was equivalent to that of unvaccinated individuals who became infected. He was arguing at the time for renewed masking, but unwittingly undermined the argument that vaccines prevented transmission, simultaneously conceding breakthrough infections were occurring. Just 1 month earlier, the President of the United States on the stage at CNN told you would not get sick if you got these vaccines. Also in August of 2021, as documented in this resolution, the Israeli data found that those with natural immunity were significantly less likely to contract the Delta variant, being almost 6 times less likely to get infected and 7 times less likely to have symptomatic disease compared to those vaccinated with the Pfizer-BioNTech vaccine approved under EUA. And yet the mandates rolled out. It's been proven that when you make it difficult for people in their lives, saying the quiet part out loud, he is. In those 2 months of 2021, you have credible evidence that not only did those vaccines not prevent infection nor transmission, but the immunity induced from infection was more durable and efficacious. This in turn calls into question the benefit of mandated treatment for those individuals who had already recovered from COVID-19. In medical ethics, the benefits of a treatment must significantly outweigh the risks, otherwise it is considered unethical. In this case, those who swear to first do no harm are duty-bound to invoke the precautionary principle. I won't delve into the 10,000 to 1 risk stratification by age between an 80-year-old and the 10-year-old as documented in the resolution. You have probably noticed this argument hinges on a critical factor. What percentage of the population has been infected by the time the mandates went into effect in November 2021, and how would we know that? Seroprevalence studies, and it turns out we might just have one specific to our region. Now here's a legitimate complaint against the resolution as written. It is purported that some of the data from the Sanford Survive study was used to publish a paper titled Severe Acute Respiratory Syndrome, Coronavirus 2, Antibody Prevalence in Healthcare Workers Population Exceeded Self-Reported Infection Rates of 2020. This is what Representative Aylward alluded to. The abstract reads, a study of severe acute respiratory coronavirus 2 seroprevalence at a healthcare institution prior to the availability of vaccine showed that seroprevalence in the cohort increased over 6 months from 25 to 55%. The number of employees with antibodies was higher than the number who reported an exposure or diagnosis at each time point. So at the end of the study, the percentage of healthcare workers that were seropositive were 55%. So when did the study end? Quoting from the discussion portion of this document, our survey of patient care employees at a large healthcare system from June 2020 to January 2021 revealed increasing SARS-CoV-2 seroprevalence over a 6-month period a few sentences later. Previous studies have also found that seroprevalence among healthcare workers reflected seroprevalence in their surrounding communities. So by January of 2021, 55% of those surveyed were antibody positive. And the paper argues that previous studies have also found that this reflects the seroprevalence of their surrounding communities, our population. This is a full 10 months before many of the mandates went into effect. What was the antibody positive rate at the time? Did anyone measure it? This was purported to be a 1 in a 100-year pandemic. Doesn't it seem important? To sum up, 10 months before mandates began, over half the population could have already had more robust and efficacious immunity than the vaccine could offer. They didn't prevent infection. They didn't prevent transmission. The community benefit was negligible. There was no evidence that conferred mucosal IgA immunity via the intramuscular injection into the arm. The individual benefit was negligible. Over half those surveyed were antibody positive at the earliest point of the vaccine campaign. Back again to medical ethics. If over half the population was to gain no benefit from this mandated medical treatment, and there was only risk, if I had time, I'd tell you about my father's vaccine injury. What have we done, and what have we allowed them to do? Divide us, stoke animosity, destroy the credibility of the medical community? At this point, you should all have lots of questions. For example, how many people were forced to take vaccines that have already recovered, even if asymptomatic? Was this medically ethical? Furthermore, is it medically ethical to allow it to continue without screening? Thank you for your time. Please pass the resolution out of committee. You all need to discuss it. Send a message.
Okay, thank you. Do we have any other proponent testimony?